Hello everyone, my name is Ezequiel Gutierrez, and should marijuana be legalized? We have all heard about Mary Jane, Juana, hemp, devil's lettuce, mota. All of these are the same word for the same plant, cannabis. Cannabis has been used for the past 100, 200 years for its recreational and medicinal uses. In recent years, there has been discussions on having it removed from a tier 1 drug. It's up there with cocaine and heroin, and having it removed or legalized due to its more medicinal uses as well as its more less severe effects on the body when taken recreationally. Touching on the medicinal properties, CBD, which stands for cannabinol, is the non-addictive part of cannabis. It's been shown with the study done by Harvard. Peter Grispun says that it can help alleviate stress, depression, anxiety, epilepsy. And with the National Library of Medicine, a study conducted to see if it treats ALS, which is a chronic pain disease in the arms, legs, and it was shown that people who took the drug reported having a less sense of pain throughout the day. The important part of this is to know that studies are still needed to be done. CBD, relatively speaking, is a new drug on the drug scene. It needs to be studied further to see if there is actually any evidence backing up if it's helpful or not. It can also be a placebo. People want it to work, so marijuana eventually gets legalized. It works legalized. People think that, and they may lie, or their body thinks they're feeling better because of it. THC is the addictive part in cannabis. It stands for tetrahydrocannabinol. And we all know what marijuana does to the body. It creates a sense of sleepiness, drowsiness, relaxationist. A way that could be used medicationally would be with insomnia. People could take THC to relieve their lack of hunger. For example, with cancer patients, when they take hard medicine like chemotherapy, which causes loss of hunger, they could take THC to cause hunger, which is known as the munchies. As well, it can also help with pain more strongly due to its more like relaxation of the body causing feeling. But no drug is safe 100%. There's always a con to it. The con with CBD would be that it can cause liver damage. Similar to Tylenol, taken too much, it can cause problems with the liver, almost like alcohol. As well as it's not recommended to mix CBD with regular medication, just because there isn't a lot of study yet with it. As well as a study done by the National Library of Medicine, it was also shown that it can cause fertility issues in men. Men who took CBD were shown to have a less sperm count compared to a normal man, and that just causes more controversy to be on it. As well, there's no set dosage. Since it's not a regulated drug yet, you can go by 800 milligrams of it in this one state, and also by 10 milligrams in another state. There's no regulation on how much is safe, how much to take for a normal person. And the cons with THC are all well known. First one is smoke. The most popular way to consume cannabis is by smoking either a oil made from it or the leaves actually, or the flower or the seeds. Smoke is bad for lungs for obvious reasons. Lungs are made to take air. It can cause blockage in the CO2 exchange, as well as taking too much. It can actually cause a thing known as greening out. This causes when an overdose of THC is caused, and it causes the body to feel a sense of paranoia, of fear. What's the word for it? Feeling nauseous, vertigo. It can cause vertigo in the body extremely. As well as when a woman is pregnant, THC can have negative impacts on the baby. With like alcohol, it can help. It can not help the development of the baby's brain. This was shown by the study done by the National Institute of Drug Addiction. THC is an addictive drug by their standards. People may say it's not addictive, but like coffee is not addictive. You can still crave coffee, and that's an addition to it. Overall, cannabis is a relatively new plant on the drug scene. I feel like there should be more study to it, but I do feel that there is hope that it could be used medicationally. Due to the already done trials with it, it has been shown to help people. Would you try cannabis if a doctor recommended it?